Councilman Brazel to bring folks up in the order that he thinks fit to talk about to us. And then the next thing I want to tell you is we want to hear what you have to say. And please try to hold, we have an hour and we have a lot of people here. Try to hold it for a few minutes and then please hold the podium for a couple minutes and we'll ask you any questions that we might have at that time. And then once everybody's had an opportunity to speak, then we can discuss it in a little bit greater detail how it all fits together. That being said, Joe, who would you like to?
Yeah, guys, like what Mr. Cronin said, what we're trying to do here is, I think for the most part, the county council may or may not, but I think they're in agreement that we have a problem. We have a very serious problem with heroin in this county. We have something that has to be done with it. We're having an increase in crime. We're having crimes on people, and we have heard people talk about that. You see more overdoses. So what we're not asking you to weigh in on the political aspects of opting out of the sales tax holiday. That's not what we're asking you to weigh in on. What this council wants to do is a conversation came up that should we opt out of it? Should we opt out of the tax holiday that we have the opportunity to do? In the same conversation, a week prior to and a week there of that conversation, me and Mike Klinghammer were talking about the crime problems we're having in certain areas. We were talking about the heroin problem. We were talking about things going ways we didn't want it to go this way in St. Charles County. And then at the same time, we're talking about funding. We're talking about how are we going to pay for it? How are we going to get more officers? How are we going to do more crush programs? How are we going to do this? So in the same breath, we're trying to figure out how to fund stuff. And in the same week, we're talking about opting out of a tax holiday. So I said that if we are going to consider doing anything of opting out, then it's got to go specifically in the ordinance for this purpose. It was drug enforcement. And my initial thought is to put it in for 2 officers. Me and Mike and Joe, we talked about it. We thought that was a good plan, but then maybe there's a better plan. So that's what we're going to try to have a conversation on. So we want to talk about the problems that we see out there and what things can be done. So I'm going to ask the prosecutor's office, Steve, and Leslie, you guys want to come up, and Dave Lewis with the ambulance district, you can come up and sit at the table here, and we can, you guys can start, and maybe, is it going to be Chief, or you and or Chris, or who's representing your end?
Chris can handle the PowerPoint, and Hope is here because we had multiple questions about how we would attack this. So Val will be also, we don't know how to sit up there.
We're going to give about 10 minutes with the amount of people we have here. We can start whatever you guys want to do. Sister, who's representing your group? Is it Bill or?
Bill and Megan.
Okay. And then Hope, you.
Hope was incorporated into our PowerPoint, Councilman.
Okay. All right. Well, let's Steve. I'm going to Steve. What Steve was asked to talk about is the crime problems that they've seen brought into their office, and then Leslie's here to talk about Crush, to give us a kind of a quick scenario of Crush, and the fact that there were a lot of questions asked last time when Tim Lennar gave us a presentation. We're like, why aren't you doing more classes? And these are very important classes, and well, because they don't have the funding. Okay, so Steve.
I'd like first to thank the council in regard to recognizing the problem we have. This is a subject that is very near and dear to Mr. Lomar's heart from the moment he stepped into our office. That was one of the first things we sat down and talked about. This, and it truly is an epidemic. Our possession and distribution numbers have not grown significantly as a number of cases. What's most interesting, though, is that the numbers of heroin and opiate related drugs that we're seeing either in a possession charge or distribution charge are making up a vast larger majority of the number of possession charges. We used to see more methamphetamine and cocaine charges. Now we're seeing mainly either hydrocodone, oxycodone, or heroin, morphine, those type of opiate-related drugs. And what's most important to understand about these drugs is, I've been a prosecutor for 24 years. I maybe remember 1, maybe 2 deaths from cocaine or heroin or methamphetamine in my entire career. What we're seeing now Heroin does not discriminate. It doesn't care if you're white, if you're black, if you're middle class, poor, if you're rich. It kills, and it kills everybody that it deals with eventually. And it's more, not only are we seeing more opiate-related crimes within our possession class, but we're seeing more opiate or heroin-related crimes within our stealing, within our burglary cases. Almost every time we get a case that involves, say, a receiving stolen property, where somebody is pawning items at a pawn shop, when we're able to identify that person and they're brought to justice, almost every one of those people we're seeing now, it's because of a heroin addiction, and they're having to feed the habit. And the number of crimes that are out there that are not being reported is huge. And when I say that, it's because most heroin addicts start by stealing from their own family, and those are crimes that go unreported. Once their family finally cuts them off, kicks them out of the house with many of the young adults, then we start seeing the residual effects down the road. Breaking into cars, breaking into homes. Years ago, I never would see a heroin-related robbery. We're starting to see those now because they've got to feed their addiction. It's not only physically, but it is a mental addiction. It's got to be fought on every way, and I think Crush is great that Tim started because it's a team effort. It's just not law enforcement. It's just not education. It's just not treatment. It's everybody working together. And Leslie's going to talk all about this, but again, thank you for the time and for recognizing that we have a very serious problem in this county.
Thanks, Steve.
Okay, so Crush was started in May of 2015, and we brought together all the community partners at that time we thought was necessary, although I did a more detailed review for you to cover, because Crush is in its infancy stages though, so we are continuing to grow. Like we would like to still include clergy, more of our business community, and so we are continuing to work on Crush. But it's essentially Community Resources United to Stop Heroin. And what we do is we meet once a month. We do have a steering committee who helps us plan and determine what our goals are going to be. We set a mission. We registered our coalition. And now we spend time doing what we can to get into the community. Our number one achievement, in our opinion, is our Teen Drug Summit, which we've had twice now, where we bring together about 350 middle school students, and we educate them in one setting. We provide lunch, schools provide transportation. It's a great day of prevention. We end on a positive note, reminding kids that this is a choice and you can make it. We empower them. We then expect them to go back and then teach their schools. You know, they then provide their own presentation to their own school. They see it as a great reward, and we have found it to be extremely successful. I have as far as Indiana calling me to talk about the Teen Drug Summit and how we do it. So we also go into schools. We provide prevention materials. So if I go into the community, I will hand out my bracelet, I'll give Deterra bags, I make sure they have a card. We provide resource cards for our officers to hand out. We do include law enforcement, treatment agencies, schools, so that we're looking at this as a holistic problem. We don't look at this, even though we are law enforcement, we are trying to be proactive with prevention. This is not an easy undertaking though. It is quite the job, because it is grant writing, it's project management, it's contract negotiations. It is very time consuming, and it's fiscally draining, because one of the problems with Crush, and one of the reasons why we want to come to the council, is so many of my funds are restricted. So therefore, I'm very restricted on what I could do. And what we we just feel like we could do so much more if we had some unrestricted funds where I could just go and pay a vendor fee and go and do community outreach. But I just can't go do that because I'm restricted with my funding. We're mostly funded through HIDA, which is high intensity drug trafficking area money. DEA gave me $5,000, but they paid it directly to the convention center, which was great. And then we also get some grant funding through ACT Missouri. But other than that, I have no unrestricted funds to do some of the things that we'd really like to do, because we really need to keep growing and expanding, and like brand management, I really could, we really need to be doing some branding.
I saw in here you're asking for basically $20,000, of which 5,000 you need pretty quick like, and the rest for contingency. The 20,000, is that what you need annually? Is that what that last you a couple of years? How long would that last?
That could last me 2 years for sure.
Okay.
Yeah,
so
I can
roughly-
make it last me 3 years.
So roughly 10,000 per year or less,
Right.
okay? Now, if you've got restrictions with finance, we happen to have a guy here that's in charge of those restrictions. How much latitude can you give this lady, or do we, within our purchasing guidelines? There's not much, is there?
Talking about a supplemental appropriation?
Yes, sir.
To the crush fund?
Yes, sir?
Uh,
It still have to go by normal purchasing finance guidelines,
Well,
right?
no, let me back up for a second. What is restricted is what I can spend it on, not so much my finance. The finance is great for me.
Okay.
No, it's like, so if I want to have the teen summit and it's going to be $12,000, DEA says you can't spend it on food. HIDA says you can't spend it on food.
It's the grant money that's fun.
Grant,
But
you
wouldn't
can't
have
spend it on food.
There's not a problem with county-directed funds then?
Right, as long as I follow my.
Bob's rules.
Right, Bob's rules, I'm good.
Okay.
So, but I just want somebody to say, here's $20,000, and if you need $5,000 for food, that's okay with
Okay.
us.
But so Leslie, $20,000 for now would double your education. You're not saying that that's good for 2 years. You're saying $20,000 would be great, and then next year $20,000 would be even better.
Fantastic.
Yeah, so you're not saying you just need
No.
10,000 per year.
Right.
Okay,
Yeah.
okay. Steve, anything else that you can add, or, yeah, I noticed the percentage of deaths here are 85% in 3 years. It went up 85%. That's about from 40 to
2 years
50.
ago, I tried personally a heroin overdose case involving an individual named Jason Shell, and Dr. Mary Case testified. She's the medical examiner for 3 different counties. At that point, she was saying she was seeing at least probably for St. Louis County, there's usually about 1 death per day, and it's
St.
fairly
Louis
close. It's pretty close in the city now. In St. Charles, it's not severely that bad, but between her 3 counties, she was seeing 2 to 3 deaths a day, and that's very serious. The other problem we have is that case, the individual was convicted of distribution and manslaughter. The Court of Appeals came down today affirming the conviction on the distribution, but overruling the conviction on the manslaughter. And the reason being is the individual supplied heroin to him, watched him use the heroin, realized he was having a medical problem to it, drove him past the hospital and dumped him off at his house where he died. And the Court of Appeals did not feel that was sufficient evidence to convict. So we're doing the best we can, and luckily he got a larger sentence. He got an 18-year sentence on the distribution because he was a prior and persistent offender. The Court of Appeals affirmed that conviction, so he's not getting out of prison. But we have to look at alternatives of going to our legislature and asking them to correct some of the laws, of trying to maybe put a circle peg into a square hole and be much more like the federal government that has a statute that allows for, if you distribute a drug and it kills somebody, they actually have statutes in regard to that, and their statutes are a lot tougher than ours. And so it's got to be fought on, like I said, every angle. It's got to be fought from the legislature, from law enforcement, education, from the community, from treatment. And
All right. Thanks, Steve. Dave, you want to add something? You want to talk a little bit about what your guys are seeing out in the field and what problems you're running into and your statistics, how they've been increasing and that sort of thing?
Certainly. Councilman, thank you for the opportunity to speak tonight. My name is Dave Lewis. I'm the Assistant Chief with the St. Charles County Ambulance District. Our paramedic personnel has seen a marked increase in heroin and other opiate usage, overdoses, deaths here within St. Charles County. The increase in resultant physical, psychological, social, and economic damage isn't only affecting the individuals, but it affects the families that we see, and it affects the communities as a whole. The facts here in St. Charles County are staggering. In 2015, we closed out with 381 overdoses where our paramedics responded and Narcan was used. That's over one a day. So coupled with that, 2016 is on par to keep pace with 2015. When I handed out an infographic here, and basically we extrapolated the first quarter data through all of 2016 to show that that's on par to keep pace with 2015. Since 2008, the number of heroin cases that we've responded to, as well as deaths in St. Charles County, have doubled in those 8 years. So that's good with your portfolio, bad in your community when you're talking about overdoses, doubling in 8 years. In direct response, the Ambulance District has directly supported the training and equipping of non-medical personnel first responders with naloxone, or Narcan, which is an opiate antagonist. It blocks the opiate receptors. Basically, it reverses the overdose, but it's only as good as the medication. Sometimes they have enough of the drug on board that it outlasts the medication, so they still need help. With that, we've trained most of the county fire protection districts, Central County, Cotterville, O'Fallon, Augusta, Rivers Point. We've also trained the St. Peter's Police Department. SCAD participates in a multi-jurisdictional task force on this issue, and thanks to the prosecutor's office and Crush for making this multi-jurisdictional. Before that, we were all operating in our own silos, and truly to combat the problem and make a difference, it's going to take us all working together. We've entered into a data sharing agreement with the Public Health Department, and for the first time ever, we're looking at raw data that's telling us, that's surprising us. And I'm going to let Hope talk here in the weeks and months to come, but you would think that this is a young person's game, but it's not. It's affecting those of us that are of the age that are sitting here at the table. That's our largest demographic that's being affected by these overdoses. Not what you would expect, not what I expected. So our additional planned initiatives at the Ambulance District include equipping our paramedics with the training and to connect those in need with resources and programs to help them fight this deadly disease. Our SCAD paramedics are in direct contact with those addicted and afflicted, as well as their families, and that's a teachable moment time when they're most vulnerable, and if we can connect them when it's finally hitting home with the resources that they need, maybe we can make a difference, because it's not just responding to that overdose, it's preventing it that we really need to do, and it's primary prevention. And again, that's Hope's arena, and she'll talk to you about primary, secondary, and tertiary prevention. So any questions that I can answer for anyone?
You guys got any questions?
Problems there.
Chris and Hope, you guys got the same presentation?
Yeah, they're embedded together.
So all of that together, Joe.
Okay, you guys ready for him?
Sure.
Yeah, go ahead and pull it to your.
Sure. Jack can pull up the screen real quick. I'll start. I know we're limited on time, so half of this is statistics of what we're seeing in the drug trade in St. Charles County. The other half is our response and our educational approaches to this. But first and foremost, the police department's approach to this is we cannot arrest our way out of this problem. I mean, this is a bigger problem just arresting and prosecuting folks. So as you'll see in 2015, the Drug Task Force initiated 704 narcotic investigations. They had 283 undercover purchases of illegal substances, and you can see the list goes on. They consent searched 90 homes and executed 109 search warrants based off of those purchases in the Drug Task Force. This is a map of all the search warrants that have been executed just since February 5th of last year. So within the last year, 18 months, this is where all the search warrants have been executed in our county for illegal drugs. Not just heroin, but just illegal drugs. These are some photos of, and these are all in your packets, these are some photos of actual houses that they've gone into and the product and illegal substances that they pulled out of these homes. So like I said, it's more than just heroin, it's marijuana and methamphetamine. So specifically to heroin, last year alone, they seized 981 grams of heroin. I know that probably doesn't mean a lot to some people, but that's 2.18 pounds of heroin. 1 gram is 1 dose of heroin. So 989 doses were taken off the street last year by our drug task force. So it's a little over two pounds of heroin. In years past, you can see in 2014, it was only about 100 grams, and the year before that was 30 grams. So there's been an explosion of heroin usage or enforcement out here in our county.
Chris, did the heroin substitute the methamphetamine?
You'll see here in a little bit that the methamphetamine has gone down, the production, but you'll see that the ice, the methamphetamine that's coming out of Mexico, has increased significantly.
Well, we killed a lot, Councilman. Manufacturing meth was a problem because we were cracking it so hard and hit them. So they don't manufacture it here in St. Charles County anymore. They're bringing it up from Mexico. The downside is it's more potent, but they're not manufactured here. We're dealing with the sales more than we're dealing with manufacturing here. Go ahead, Chris.
So marijuana is significantly up too, and that has a lot to do with, now that it's legal in some western states, it's being trafficked in here and it's coming through our county, either being distributed in our county or it's just passing through. So that's why you're gonna see that last year we see 791 pounds of high-grade marijuana off of the streets here, just in our county. So there's an increase, significant increase in marijuana too. On our prescription seizures, things like oxycodone, they didn't have any of those in 2015. And that's because heroin is so cheap. A drug dealer can go buy a kilo of heroin for $2,500 and he turns that into $10,000. So he's stepping on it with other ingredients to spread it out. He puts it in the capsules and he's quadrupling his money. Oxycontin is down and steroids is up. They had a case last year, they had a significant amount of steroids. So that's why that number is inflated a little bit. But you can see that overall prescription drugs is up. They had 651 doses taken off the street last year. Meth seizures, like I said, this is 46 pounds of methamphetamine, which was ice, was taken off the streets in 2015. So that's 20,921 grams. So that's a significant increase from years past, and that's because of the influx of ice. And I know DEA is actively investigating cases out of Kansas City that are affecting St. Louis, and they've tracked it back to Texas and the border crossings in Mexico. So they're doing everything they can to get a handle on that, as well as a handle on the heroin. So they're both a significant problem. Distribution, sales, and possession arrests. They had 92 distribution arrests last year in St. Charles County. So they arrested 92 drug dealers that were selling just heroin. 40 marijuana drug dealers and 53 meth dealers. So the meth sales are down, but the heroin sales are up and marijuana sales are down just a little bit. Trafficking arrests, these are large loads of narcotics. Heroin's down, because they're focused on the street dealers, and not focused on the guys trafficking it in vehicles and driving it across the country. So while that number is small, don't let it fool you, that's still a significant amount of heroin that was removed from the public use. In 2015, we sent to the prosecutor's office 102 cases for distribution. I don't know how many were prosecuted or pled out or what the conviction rate was, but our drug task force sent 102 of those cases just for heroin alone to the prosecuting attorney's office. Yes, sir.
And if we passed on to them before, the undercover officers have dealt with multiple drug dealers who would not cross the bridge into St. Charles County to make the deal because they did not want to deal with our prosecutor's office. They would not cross over here to do business with us. Yes, sir.
While we're on that subject, the gentleman from the prosecutor's office?
Steve.
Yes. Is your office funded adequately to deal with this higher amount of people being charged?
The county did give us a new prosecutor who is specifically assigned to working with the drug task force.
Okay.
We're now at the same levels we were in 2003. We were at 23 attorneys in 2003. We did lose one during the budget times. We were back to 23 attorneys. I would be remiss to say we could obviously use another prosecutor and more staff to help deal with this, but we understand the budget constraints, and we certainly appreciate what we received this last year.
You're keeping your head above the water the way it is now, though.
And they also lost 125 cases a week approximately when we took county traffic out of there and put it in the municipal court with a part-time
So
prosecutor.
their funding level for right now is fine, essentially.
That's been Tim's discussion.
Well, Mr. Lomar would, I think, let you know that we could always use more
I
prosecutors.
asked Mr. Lovemore to let us know.
And part of the problem is the number of judges has grown. When I first started, there were 7 judges. They've now almost doubled at 13 judges. That means we're stretched thinner than we ever were.
Federally, in cooperation with the U.S. Attorney's Office, last year we charged 15 people federally on heroin-related charges and 10 on MDMA and ecstasy charges, that's just a molecule off of methamphetamine, and they sent 2 federally to federal prosecution. Firearms, as it relates to some of these drug cases and these search warrants, the Drug Task Force took 19 guns out of heroin houses last year and 56 guns out of marijuana houses. I think I have some pictures on the next slide of some of the guns that were actually taken out of these houses. So you can see what our officers are up against when they go into these houses and why, and I'll get into it here in just a minute why we use SWAT so often to go into these houses. So the chief's response to this has been kind of twofold: education and enforcement. The DARE program, which we currently use right now, is you're all familiar with. They educate kids and parents in schools. And the chief has directed our school resource officers to develop a more comprehensive program in place of DARE that the school boards are going to be presented with that we hope will combat this epidemic a little bit further. So that's in the works right now. It should be done by the beginning of next school year, if not just a little bit into it. So we're working hard on that. Narcan, as you've all heard, we started using Narcan. Dr. Tan has provided us with all training, and we've had 8 Narcan deployments, which has resulted in saves just with our department. And I know this is spreading to other departments. I think Wentzville now has Narcan, St. Peter's. So a lot of people have come on board and have used our example as to how to respond to this. Our public affairs coordinator, Val Joyner, who I'm sure you've all have met, I'm going to have her stand up here for just a second and talk about the things that she's involved in as far as educating the public.
Thank you for having me here today. So I'll talk a little bit about our community engagement and education. You've often heard people say that you can't really arrest ourselves out of this problem. So what we've also tried to do is take a proactive educational approach to heroin and prescription drug abuse, and just letting the community know how they can prevent drug abuse in their homes and also around the community. So for proactive community outreach, what we've done is established Facebook and also Twitter accounts for the police department. And for Facebook, we've grown exponentially over the last year. We started at maybe close to 2,000 when I came on in April, and we now have over 11,000 people. So these are 11,000 people who get to see messages about, drug abuse and how to prevent it, candy confusion for children. So that's when children see candy and they also see prescription drugs, and they may get them confused and they may take the prescription drug instead of the candy and get sick. And what we do is we push those messages out, and we put them out in posts and testimonials and video links so that the community can know these are ways to keep your home safeguarded from different drugs and also prescriptions. I passed out some folders earlier, and it has a lot of the educational information that we have available in our lobby in the station. And these are also materials that we have available when we go to community outreach events, and we share them with our community partners so that people in the community can know, ways that they can safeguard their home and also their businesses and families from different drug abuse. So when it comes to the prescription drug take back, if you didn't know, we have a medication disposal box in the office, in the lobby of the police department. And this disposable box is available 24/7, 365. So that means that people can come and they can drop off their prescription drugs any hour of the day. It doesn't matter. And that gives flexibility for people who work and for people who just need to drop it off when they find it or they make the time. And we've had 2 different events one in 2015, and then one also recently that we collaborated with the DEA. And I want to proudly report that in 2015, and this was just with our kickoff event for the prescription drug box and also throughout the year, that we collected 562 pounds of unwanted, unused, and prescribed or expired prescription drugs. And in this quarter alone, this first quarter of 2016, we collected 179 pounds of prescription drugs. And then also for parents, you know, it's very difficult sometimes to approach your children and to say, you know, I suspect that you're using drugs, or you may be hanging with the wrong crowd. Well, we've partnered with an organization called Test My Teen. So what they do is they offer a free drug testing kit for parents. And there is a $6 fee for parents to just get that drug testing kit delivered to their home. And it's packaged confidentially. So that voucher is available in our station, and all a parent has to do is call us or maybe stop by and say, hey, I want to test my teen voucher, and our in-house officer can make that voucher available to the parent. Or they can go onto our social media sites and soon on our website and just print that voucher off, or even when they're in our lobby, they'll see it on the message board. If you've ever stopped by, they can just write down the code and go on to Test My Teen and plug in that code, and they can get that voucher at no cost, and no one will ever know. And it's a parent conversation that they can have with their child alone, and again, no one will know, but they can get the results that they need.
Are the schools, the schools aware that you have that service? 'Cause I think
Yeah.
that would be,
The schools that we've communicated with, because a lot of times when we have events, we'll have, you know, students from the schools, they are aware that we have it. And again, I'll continue to make them aware if they're
so it's
not.
completely anonymous for the parents and the children, just for the parents to know if the kid's got a problem.
And the great thing about Test My Teen is that they will connect the parent with, you know, different outreach organizations in the community and experts in the community for counseling, so that they can take whatever steps that they need to take to get the counseling and whatever other services that they may need.
Great.
This isn't about getting arrested, it's about getting them help.
Sure, it sounds like a great program. First I heard of it.
And you'll see a voucher in your package, so you can see, you know, what it says. And then also, anytime that a parent goes on, we get credit, if you will, that they got the voucher from St. Charles County Police Department. And then also, if you don't know, we have different community partnerships with NCADA and then also with Crush. And again, these are the people that we can call up, everyone that's in that folder. We can call them up and say, hey, we're out of supplies, can you give it to us? And they'll send us more educational information. Thank you.
And I have to give Val some real credit for that take-back box in the lobby. You have to have a partner who can dispose of those drugs. And as you can imagine, the pharmacies don't want to get involved with just anybody who wants a drug box. So, you know, she worked hard on convincing CVS to be the sponsor, because that's who's disposing of the drugs properly. So you just, and Leslie's nodding her, she knows, it's really tough to get those boxes in place and have them there, because you're seeing the quantity of drugs that are coming in. Now, some people may be bringing in their, their nasal spray or whatever, but a lot of what's coming in are people bringing their extra opioid prescription drugs that they no longer need.
We, just real fast, to little piggyback on that. So when I'm in the community, because I don't have a drug bag, so we have the Datura bags, and, you know, able to put the logo on it, that we hand out to the community, because when your prescription's done and you have 3 left, you know, you start this open, you put your pills in there, do that, and they're done. You can actually throw this in the trash can then. They are completely disposed. There's like some kind of coal or something in there. So I've ordered hundreds of these to be able to hand out, so that we can, what I really want to do is go to pharmacies and ask them to hand this out with a prescription of opiate to someone, to say, here, we just gave you OxyContin, here's a bag, so if you have any left over, dispose of them.
Hey, Dave, does a DARE officers give education training in the classroom?
Pain medicine.
They do. And that's a whole different story, but we're pulling from DARE, and they're working on a term. We want to teach the children what's pertinent to St. Charles County, not what an organization decides. So that's one of the things where we're switching to our own program, is to get more involved with the drug education, which we think needs to be taught in St. Charles County, not what's dictated from someplace else. So yes, that's correct, but it's going to get more detailed for us because of the heroin problem, teaching the parents also.
And we've gotten some good feedback from the schools about the idea of doing that. I think DARE education's been out there a long time, and it's done some good things, but there are things that can go beyond that now, and that's why they're trying to get the curriculum rewritten.
Okay. All right, Chris, you want to keep going?
This is some of the people that we have, the police department's partnered with, obviously, is the prosecutor's office, Hope's folks over at the Department of Public Health, DEA, Homeland Security. As Leslie mentioned, we're in a HIDA area, which is a program that only covers 60% of all counties in the United States. So we're within a HIDA area. It's a high-intensity drug trafficking area. And our officers also have access to the El Paso Intelligence Center, which is a national database that narcotics officers can call and run checks on people that may have records in other states and find out details of those investigations to see if they relate to investigations here at home. So as I was talking about the health department, I'll let Hope take over the next few slides and she can cover a few of her things and we'll be done.
I'd like to start with this quote because I think this is pretty profound. Every 19 minutes, someone in the U.S. dies from an unintentional prescription drug overdose. Enough prescription painkillers were prescribed in 2010 to medicate every American adult around the clock for 1 month. And I believe that's so profound. It goes to show you that these are the legal part of the drugs. These are being distributed by a prescriber for a very specific reason, and our community is inundated with them, which gives a lot of opportunity for children to take them from their parents, for them to be disposed of improperly. So this is going back to 2010. It's been increasingly worse over the last 6 years. There's so much out in the community right now, and most parents don't realize that what they have in their house could lead to their child becoming addicted, which could also lead to their child becoming a part of the heroin world. And so the biggest role that the health department has, we have a kind of a unique niche. Data collection is the lifeblood of public health. It tells you the who, the what, the where. We collect the information as best as we can, and I can tell you heroin data is very, very difficult to get in this county. As Dave mentioned, we have a partnership now with St. Charles County Ambulance District, which I'm extremely grateful for. But I'll show you on the next slide coming up. You'll have to switch it yet. No, go ahead. That most of the data that I get is very raw aggregate data. It doesn't really drill down, tell you by age group and who's using it and what areas they're using it. So what I'm hoping to do is continue this data collection with the hospitals, with our county partners, with our cross-jurisdictional county partners as well, and try to provide better knowledge of where it's at, how we're getting it, the age groups affected, because that drives how we do our education. Another huge piece for the health department is provider education. While I think CRUSH is going to be outstanding for dealing with children and doing programs with teens and so forth, on my side, I feel like we have a unique opportunity to bring providers together. And I know we're working with St. Louis County and St. Louis City because they're usually the ones that are missing at this table, and they're the ones prescribing it.
Where are we at with working with them on the prescription drug monitoring program? Are we getting anywhere with that at all?
Where we are is St. Louis County is in the process of putting together an RFP to put out, and once that's put together, they're going to be sharing that with us so we can have an idea of what the scope of work is going to be.
I hear Mayor Slade just announced something.
Yes.
He signed
Yesterday
it
or
today.
They're
today.
joining up with St. Louis County.
Yeah.
They're going to join?
Yes. And I tell you, I have a daughter-in-law who's a pharmacist in St. Peters. That is a huge problem. And if you talk to the pharmacists, they'll tell you it's a problem because the folks are doctor shopping, they're getting those pills, they're selling them on the street, and there's not a damn thing they can do about it. So,
Well, that's the legislator. We got Missouri legislators got to figure out why they're not doing it. But until then, you're right. We need to partner with our communities on whatever the database. If we got to see how it works first, though, before we can have the conversation.
Right, I mean, you're not behind at all because St. Louis County and now the city have passed the legislation, but until this RFP is done and we have some idea how the tracking would do, it won't actually be out there as an entity doing any good. So, you know, we've been tracking with them. Host's been talking to their health director continuously. So when they have the RFP done, they're going to share it with us about.
my daughter-in-law said in other states that she's trained for that. She said that it's mostly done to the insurance companies' databases, which I found kind of surprising. But they said a lot of those folks that are out there doctor shopping are cash customers, they don't even use insurance. So, but I mean, if other states, 49 other states have done this already, it shouldn't be too hard to figure out a way of doing it. Thank you.
Well, and those states, I will tell you, are not all uniform in how they do it.
I see.
mean, there's a number of different ways to do it. So I think that's one of the reasons why we want to see what St. Louis County is actually proposing. We want to make sure it is going to be effective. They were initially talking about leaving out their outliers, basically places that would take purely cash. And I think they're trying to figure out a way not to do that. So we're just waiting to see what their RFP looks like.
So provider education will be a huge piece, or a role for our health department. Parent-child education and referrals, that's supporting CRUSH and all the different initiatives that they would be putting together. Narcan support, obviously we're a big advocate. The more we get out there, the more lives that we can save. Policy support, obviously we want to have a prescription drug monitoring program of some sort, and a good one that will work. Supporting Good Samaritan laws, so that if somebody does bring somebody to the ER, that they don't feel like they'll be in trouble for doing so if they're overdosing. And then we have a unique role in reducing disease rates among drug users. HIV from needle sharing, hepatitis C. We do see a lot of patients in our various programs that are drug addicted, and it isn't, we have to treat their disease and hope that they don't spread it to anybody else. So we have to kind of turn a blind eye, and I would love to be able to give them a ton of referrals for treatment, but there are very few within the county. The next slide shows you what I have been getting, so I can just kind of, spill out Narcan numbers that have been used over the last few years, and you can see that they've increased. But now, through our partner sharing agreement and our data sharing, I'll be able to do better results of this. And again, I'm hoping to do some data mapping for different agencies, show them age groups, schools, neighborhoods, whatever I can provide with the data. Data can tell us so much. It's just getting your hands on it that's the hardest part. So kind of just in summary, we're going to continue our data sharing with SCAD. I'm going to start getting or bugging St. Charles City Fire and EMS services for their numbers of well, which they've recently provided. From that, we'll do some data mapping. I'm going to be working with the hospitals to try to get some better data from their ER, and then continue our partnerships with St. Louis County Public Health and St. Louis City Health.
Thanks, Hope.
Thanks, Hope. So right now we have 19 police officers dedicated to drug enforcement in our county, and this breaks down how many people we have in each group. We have 2 supervisors and 8 detectives in our regional drug task force made up of all the departments within the county. We have 9 detectives detached to the Drug Enforcement Administration, 5 from our county alone, 2 from the city, 1 from St. Peters, and 1 from O'Fallon. St. Charles City also has 1 officer detached to the hotel motel drug interdiction, where they go around all the hotels in St. Charles County and they interdict drugs and assets. So the drug problem has really had an impact on our SWAT team as well. Just 2015 alone, we spent 6,525 man hours on narcotic search warrants. And we detained 246 suspects for the drug task force. And that's 90 search warrants that our guys, that the SWAT team has engaged in last year just for the drug unit alone. There's other things like barricaded subjects and suicidal subjects they've responded to, but alone there's been 89 search warrants for the drug unit in 2015. We're on pace to break that this year. So far we've had 31 and 2,500, almost 2,500 man hours. But the thing to take home is that we have spent, as of last week, we have spent 68% of our overtime budget just on our county personnel and special operations.
So if you multiply that, you're going to be at 9,300 hours potentially. So
Potentially.
I got a substitute bill that I just showed to these guys, but it's just for conversation. One of it was to not have the 2 officers, but get some in overtime and give some in, and this is just purely for conversation, but have some different ideas with how to best combat this problem. And one thing I noticed is that the drug guys, the SWAT time guys get overtime, but the drug enforcement guys do not get overtime. They get comp time. And in my view, it's could be counterproductive because they're so busy with what they're doing that it's hard for them to, they get the comp time, but they can't ever take it because they're so realistically so busy. So I thought that it'd be some conversation to have if St. Charles City guys are getting overtime and nobody else is the only team that doesn't get overtime. I truly don't think that's fair, and I think that they should get overtime. I don't think they should get comp time. So I think that's certainly a conversation that needs to be had. I would like to see that if we did do it, that perhaps the other, I know we can't make the other cities do it, but it would seem like that's what the team's doing, so everyone on the team should get paid the same. And that's one thing that we talked about is putting overtime. We got some funds distributed in there. Like I said, it's just the account numbers. Greg put it together for me, getting with Bob, and it's purely for conversation to try to figure out how do we best combat this problem. And I don't know if this is a solution or not. I put some money in it for Crush, put it for one drug enforcement officer, but I hear you keep saying that you can't arrest your way out of it, and I get it. So by getting another drug enforcement officer, does that make sense? I don't know.
Yes. What I'm asking for your support on, and which you've been more than gracious on, instead of the two, what I'd like to do is replace the drug sergeant. The drug sergeant left, there wasn't one replaced. We would replace the drug sergeant from the county PD. That position isn't funded. I would do that with that funding. Part of that funding. What I would request after that is you sit down and you talk with all these wonderful groups. We can arrest them, but if we can get some of them out of the business of doing drugs, that would help also. So my request would be that we get the one officer funded for position, and then the council meet and talk to these folks, what else we can do to help fight it from the other end besides putting them in jail. Crush, health, other, yes, sir.
Okay. One thing I think that we need to know, just for what it's worth, okay, is we got two issues at the council. We all want to do everything we can to keep this epidemic getting worse. But also we've got to plug numbers into a budget as well.
Correct.
So your numbers were very clear. I appreciate that. Hope from you. I'd like to know what you need. You don't have to tell us now. We've got 2 weeks to make this decision. What your department needs outside of your normal budgets, okay, both this year and what you think you can do the following year. Chief, I need the same thing from you, okay, for us to make a decision, okay?
Absolutely.
Okay, and then Bob, then you're the number scruncher. And I think, you've pretty much already told us what you think the holiday is gonna cost, sales tax holiday, then we're gonna have to see if there's other additional funding that we can, to do this. Ideally, we don't take this lightly, getting rid of the sales tax holiday for school kids. We'd like to be able to have our cake and eat it too, maybe take care of the drug issues that we have and combat them the best we can, and also maintain that holiday. But whether or not we can do that financially is yet to be determined, okay?
Yeah, and Bill, you want to come up here? I apologize. This is come on up and then this is Joachim and Ann. They're here. We invited them. Both you guys come on up and grab some chair. Or you can,
I just was, in summary, I just wanted to say that education and focusing on all of our partnerships in the metro areas are the two key essential things.
You're going to stay there then. You guys head on down and just give us a little review and or view of what you guys do. We got less than 10 minutes, but sorry it got to you last. Steve, you can stick around. Don't leave just yet. Yeah.
First of all, thank you, Council, for doing this. We really appreciate it. I also want to thank law enforcement who partner with us with St. Joachim and the 180, which is the reentry program for St. Charles, Lincoln, and Warren County. And the men and women that come and talk with us are awesome, and I really appreciate what you do in the community. This is Megan Hastings. Megan is with Preferred Family Health. She is one of our partner agencies. She is the clinical supervisor over on Westbury. I don't know if you're familiar with that facility there. And you have the capability of housing how many children there?
At the residential site, we currently have 16 residents who live there, and so they receive residential treatment, so they're there 24 hours a day. They receive counseling, individual counseling, group therapy, individual therapy, case management, things like that. So that's where we see a lot of our kids with heroin issues and prescription opiates. We actually, besides marijuana, alcohol and opiates are our highest admit rates. So it's kind of shocking when you see 14 and 15-year-olds come in and their drug of choice is opiates. Are seeing kids and teenagers who have overdosed and died from heroin abuse when they've been your clients before. So I think that's why we're here today. And we partner with Crush as well. And so working on, like they said, we can't arrest our way out of it. And so we're kind of on the back end of that and getting those kids and adults treatment and dealing with those people. Because a lot of times my program specifically does prevention, and so we deal with 5 years old to 19 years old. And so we actually have a lot of 5-year-olds and 6-year-olds right now whose parents use prescription drugs or heroin, and they're overdosed in the other room, but there's another parent present, so nothing can be done. So a lot of times that's what we see.
What do you do with the parents? When you have parents that are doing that to their kids, what happens to the parent?
So you can hotline it, however, nothing can be done if another parent is there. We try to provide as much support and referrals as we can, however, it's addiction, and so we work with those kids specifically on an individual basis to give them those skills so that we don't continue the process of, addiction as a disease and as a generational disease. So that's why we work with those younger kids.
And when we talk about generational diseases, Miriam Mahan, our executive director with the Care Service, 9 years ago we created the 180 through the Department of Corrections, Probation and Parole here in St. Charles County to assist families and ex-offenders coming out of prison. And we've expounded on that by partnering with NACADA, coming up with a coalition that provides services to the community. I've been blessed in my retirement to be able to be still with the Care Service as a volunteer, but also to sit on 3 boards. One of them is the 180. I'm the chairman emeritus right now. We have a really great person there. I'm part of the Special Populations Group for Workforce Development here in St. Charles County. And I think I'm going to focus on that for a second, because that Special Populations Group consists of people that are on a committee for the Workforce Investment Board, and within that structure are the school districts, of course, Francis Howell, Fort Zumwalt, and the Wentzville School District. And what I hear every day, or every meeting I should say, and what I hear from feedback I get on email, is that the generational drug abuse is rampant. It keeps going on in the families, and it keeps going up. And what we're missing here is there's a component of illiteracy here that has to be addressed. And the teachers and the administrators at these meetings say, we need to have someone go into the homes, we need an education and training system, we need a monitoring system to determine what's going on there so that these children don't become the next generation of drug abusers. That's an important component. And it's really sad when you see 5- and 6-year-olds who can talk the talk and walk the walk already. And this is in our county.
So what would it be, Bill, if you had a wish list or you had an idea, what would it be? What if we do something like the Chief Todd suggested, education, enforcement, prosecution, the whole gamut, just put it all together. What would it be from your end?
Okay, it's an overarching umbrella. And underneath that umbrella has to come the education and training piece so that these families know what they're doing to their children. What would be my wish list is that we were able to put together through the NACADA Coalition a group of people, or through Preferred Family Health, a group of individuals, trained counselors to go into the home and address these issues. Address the issues of generational drug abuse, address the illiteracy that goes on, and through that as well, we get into an education and training component, and that's part of that workforce development piece that exists right now. That education and training component is to keep the people in a sustainable piece.
Is there grant funding available for that? And if so, if not, what would you anticipate the costs of what you just decided could be?
Is there grant funding available at the federal level or the state level? Any level. There are components of federal and state grants available, but there has to be a buy-in from that organization. And if there's not a buy-in and there's not someone willing to write the grant, someone willing to do the work, and what we're talking about here, willing to make it happen, then we can't do it.
What would you anticipate that buy-in being?
One of the things is that through the Community Resource Board, the Children Community Resource Board, we do get grants to work in St. Joe Community Care Services, in-home case management. We work in the home. And so we do get grants to pay the social workers to do whatever it is. We work with everyone. Everyone in this community we work with. Where we're seeing is that education has to be, has to increase, not only in the home, but it's having the social workers then come to you and say, this is what I'm seeing. This is the gap we're seeing. A lot of assessment. We need a gap analysis. That is all that, although we can do it, and we work with them, and we all work together. It requires money.
I understand that, and what we're looking at, just to be quite frankly, is the same question I asked the health
We
director.
can put a budget together and tell you.
Yes.
Tell you,
We-
but I'm gonna tell you the thing, that the call that I received from the county via Joe was, what is the cost of the care service? I'm gonna tell you what the cost of the care service is. It's 37 deaths that we have seen in the last few months. That we have a lifeline, you know, to a church. And how many children? And children, I'm talking about we're talking about the as low as 13 years old and as high as 80-year-olds, but mostly our group of burying so many young people, sandwiched that burying them. And we have 3 of them that one time, it was a one-time and synthetic. And that's, you know, the synthetic drugs are being built in our basements.
I
So,
understand that they can't put a price on a human life, but I
Yeah.
also understand, you have to understand, we have a certain amount of finite resources to
And
spread
so-
around, even amongst all the group that's here.
that's right, and so we
Yes.
can put a budget.
Sure.
We can get together and put a budget, using also the matching funds for this budget will be CCRB and other, you know, we all have, and your question to grant, yes, we can have grant. This is a public health issue, and one of the biggest entities that we can put together a grant is the Missouri Foundation for Health.
We only got a couple minutes left. I want to give Mike Elam, who's attending by Skype, the opportunity to ask any questions or make statements, as well as anybody else on the council. Mike?
Hey, Joe, thank you. I appreciate what Mary was talking about there. I was just curious if there's an opportunity to do matching grant programs through the Department of Health, and I didn't know if that's something that was possible. I appreciate everybody who's come up. There's been a lot of great information that people have talked about today, and that's really the big thing that I wanted to accomplish in this work session today, is to find out a little bit more all the entities that are actually hitting the street and are the first responders for this problem that we're facing. So I appreciate that, and I appreciate Joe really taking this on and setting all this up and bringing this problem to the forefront.
Any other questions on the council? We got about a minute left.
I was just gonna have Steve or Chief or somebody, you guys know, Missouri is first, this the state of Missouri, are we like in worse shape than most states? Or is this just an actual national epidemic? And it's worse, this has been worse than it's ever been, is that a true statement, that the heroin?
Worse than I've ever seen. That's absolutely true.
The heroin is much more pure, and as Miriam and Ralph pointed out, we're not talking the movies or the video of the 70s or the junkies in the alleys. We're talking about our children. We're talking about our husbands, fathers, brothers, sisters in Essex, St. Charles County. We're not talking on television downtown. We're talking here. So it's an epidemic for us, and it will take all of us. And we thank you for your support and your vision to get a grip on this.
Hey, Mr. Chairman, if I could just mention too, Megan's been extremely restrained because Preferred Family Health could probably take an entire hour telling you about how short their funding is from the state. And, you know, I didn't realize that they were coming tonight. I had talked to Mr. Hassan of Bridgeway, and he unfortunately had his 2-year-old get extremely sick about an hour before the meeting, or he would have been here. Because one of the things that I asked him are, how long are the waiting lists? You know, anywhere from a couple of days to 6 weeks, depending upon what the available dollars are. Well,
Waiting
if
list on somebody with what, a heroin problem or what?
needing to get treated. So if you finally come to the conclusion you're willing to go get treated, and somebody tells you, well, it's 3 weeks, believe me, in that 3 weeks, you've probably lost all desire to come back. I mean, I should let Megan speak to this because I've been away from mental health for 20 years now, but you know, it's not the type of thing that you can wait 3 weeks or 6 weeks or sometimes even 6 days to get somebody into treatment if you're gonna be, or 6 hours, you're gonna get somebody into treatment.
Something else down the road, I think part of the discussion is, we have money that we keep in reserve for emergencies like tornadoes and for floods and et cetera. This is an emergency, just a different type of emergency. So Bob, that's something where we're gonna need your numbers to see how much, if any, of the emergency fund could be tapped for this emergency, okay?
Councilman, you could classify this a resident disaster. That was the term he's looking for.
I think everybody can agree that the heroin, you know, if you initially talk to people, they don't really understand what's going on, but it affects everybody with the crime. We had people going out stealing cars in Augusta, kicking in doors, stealing the cars and taking their guns and then going to North St. Louis and selling them for heroin. And I guess the FBI and the State Sheriff's Department, or Police Department, you guys caught them 6 months ago or 8 months ago. But those are the kind of problems we're having. It's not just about the heroin, it's about the added crime. And we don't want to end up like a bad community. You know, we got to stay on top of it. It's important. We all live here. We love this place, so we got to work at it as a team, and that's why we're doing this.
Can I make one more point? We in this community, all of us, Crush, St. Joachim and Ann, Preferred Family Health, Nakata, who's our big partner, all of our big partners, we go out into the schools and put on information sessions and give out the Datura bags, and we give out lock boxes for prescription drugs. And one of the things that Mr. Lomar and I discovered at the last one we were at Francis House Central is that we had a whole stadium to fill up, and the only people that showed up were the people that lost their children to heroin. That is upsetting. That whole stadium should have been filled with people that wanted to save their own families and to have all the information that they could garner on drug abuse, prescription abuse, heroin abuse, marijuana abuse in this community. And it was just the people that lost their children. That says volumes to me. That said volumes to Mr. Lomar. That says volumes to all of us.
Okay, thank you
Thank
all
you.
for coming.
Thank you.
We're going to try to start the regular meeting at 7:05. Everybody get together in 2 or 3 minutes.